Hello guys, this is Bigness. You are welcome to my channel. Today we are going to look at anatomical positions. This is a representation of the compass of the body. So make sure to know your left from your right when dealing with anatomical image or a body in anatomy. Let us begin with superior position, which in layman terms refers as up or above. Example of this is the eye is superior to the nose. That means the eye is above the nose. So keep this one in mind. The next position is the opposite of superior, which is inferior position. Literally means down or below. An example here is the shoulder is inferior to the head. You know the meaning. The shoulder is below the head. The next one is lateral position, which means side or away from the middle line. Example of this position is the ear are lateral to the eyes, which we obviously know that the ear is at the side of the eyes. The next one is medial, that's closer to the middle line. Example of this is the heart is medial to the lungs, and we all know that the heart is located in between the two lungs, which makes it closer to the middle line. Now let's move to superficial position. Superficial position means closer to the skin in anatomy. An example is veins are superficial to the muscle. That means the veins are closer to the skin than the muscles. And then the other one is deep position, which is further from the skin. Example is the bones are deep to the muscle. Let's look at the next one, which is proximal position. When you say proximal position, meaning it is closer to the trunk. An example is the humerus is proximal to the wrist. That means the humerus is more closer to the trunk. The distal position is opposite of the proximal, which is further away from the trunk. An example is the tibia is distal to the femur. The trunk here refers to the thorax and the abdomen, which articulate with the four limbs. Now let's move forward to anterior position. This is the frontal presentation of the human body. So when you are about to hug somebody, the view that you see is the anterior position. Also, we have the opposite, which is posterior position. This is the back view or presentation of the human body, and it's when you are attacking somebody from behind, the view that you see. Now let's move on to anatomical movements. We have anatomical terms for some movements that take place in the body. So most of these movements are antagonistic. That means they oppose each other. So let's begin with flexing. Flexing is decreasing the angle between body parts. An example is when you bend your elbow. Another one, or the opposite one, is extension. That's increasing the angle between body parts. So if you don't extend, you flex. An example is stretching the elbow. The next movement is abduction. That's moving the limbs away from the middle line. And a clear example is spreading the limbs. When you spread your legs, abduction happens. And the next one is adduction, which is opposite of abduction. And this one, you bring the limbs closer to the middle line. And a clear example is when you clap your hands or try to cross your legs. Next one is supination. It is turning the forearm for the palm to face up. So it happens when you stretch your arms to take something from somebody. And then pronation is turning the forearm for the palm to face down. That one, when you are giving something to somebody or dropping something to somebody's palm. Protraction is moving forward and retraction is moving backwards. That means when a car comes to a sudden stop, you jerk forward, and when a motorbike suddenly move, you move back. That's that. Rotation is turning around on axis. And a clear example is when you turn your head. Maybe somebody calls you and you are trying to see or you locate the person or the voice, where the voice is coming from. That's rotation. Plantar flexing is pointing the toes down. Example is tiptoe walking. We have the opposite, which is dorsiflexing, and it lifting the foot towards your shin to reduce the angle between your foot and your legs. An example is when you are driving and you try to lift your foot from the accelerator, the brake or the clutch pedals. Dorsiflexing happens.